Afternoon, everybody. I'm Rachel from Yorkshire Sport Foundation, and I'm here today to talk you through Moving More in Sheffield and our local activation of the campaign and how we supported people with long-term health conditions to be more physically active during the pandemic and lockdown. Sorry, I had a problem then with the slides moving on. So I just wanted to start off by giving you a bit of an introduction to how we came about securing the funding in Sheffield. So the National Centre for Sport and Exercise Medicine in Sheffield was awarded the funding to carry out the local activation project. And under this is Move More, which is the physical activity strategy for the city, and also the network that supports partners to connect and come together across Sheffield. And the work we carried out included a range of stakeholders. Unfortunately, you've only got me who's presenting here today. However, we have got some videos throughout the presentation of the different partners who have been involved, who are going to share their learning about the stages which they've been involved in as well. And the project and the local delivery went through 5 different phases, and I'll go through one of these at a time and share the key learning that we found from each of them. So a little bit of a background about Sheffield and our place. So the amount of people living with one or more long-term health conditions is higher than the national average in Sheffield, and the figure is estimated to be over 100,000. And approximately 25% of people living in the city are inactive and doing less than 30 minutes of activity per week. And Sheffield's got very stark inequalities, with a 20-year difference in life expectancy between the most disadvantaged and the most affluent parts of the city. I think it's a 10-minute bus journey between those two areas, to just put it into context. We recognise that people with long-term conditions have many interactions with primary care teams, and the reconfiguration of services into primary care networks provided us with an opportunity to utilise the funding that we had locally and look at embedding physical activity into systems, processes and structures at their inception. So our initial aims and objectives for the project was to engage with and work closely with a range of stakeholders within a testbed primary care network to understand baseline attitudes and practices related to physical activity, to explore opportunities and identify priorities where change is warranted and feasible, and to deliver co-produced solutions that have the potential to be sustainable as business as usual by these PCNs. And then we'd evaluate the project and identify the key learning and share that through our networks and other primary care networks so they could adapt and implement the learning from it. So how we started off with our approach was bringing together a steering group of various different partners in the city to help design the work that we delivered from the earliest possible stage. And as part of this, we also worked with an expert co-production organisation who supported us to ensure that we were co-producing the whole way through, and also they led on some of the co-design workshops which we did in phase 1. So here are just a few photos of the workshops which we started in January 2020, and we in the workshops we engage with people both working within that primary care network from a community angle and also within the health sector. The workshops which we had also planned was with people living within that primary care network area who had long-term health conditions, but unfortunately they were cancelled due to COVID and the start of lockdown. So through phase 1 in the workshops that we were able to carry out, here are some of the highlighted areas of learning. So healthcare professionals had limited time, which impacts their availability to engage in the process and explore some of these issues. Healthcare professionals really cared and they get it, but how can we support them better? Existing and trusting relationships are essential. So even just engaging people in these early workshops, being able to get to the right people at the right time, really we wouldn't have been able to do it unless we had some trusted relationships already built within the community sector and also within the healthcare professionals of those primary care networks. And people and organisations want stuff. So how can we change these attitudes and culture for a bit more less here and now, and helping people to understand the benefit of investing more time into whole systems thinking. So our original aims and objectives were brought to a halt. COVID happened, as I'm sure was the case in other areas, and things had to change. So our original plans, working with a primary care, with the primary care network and health professionals, their time was pulled into other directions, as was the community organisations and people living within the community. So we brought back the original steering group to try and think about what we could do next and what would benefit people the most who are living with long-term conditions, to try and stay active during the pandemic, and more importantly during being shielded at home. So phase 2, we decided to create, with a collaboration with lots of different partners, an active at home booklet. And I'm just going to play a video now from Dr. Anna Lowe, who led on the development of this, who can explain it a little bit more.
I'm Anna Lowe, and I'm just going to tell you a bit about the Active at Home booklet. So back in March, April 2020 time, we were able to use some of our local activation, We Are Undefeatable's funding, to co-produce the Active at Home booklet. It's a little A5 booklet here. We worked with partners locally, regionally and nationally to co-produce the booklet. It's aimed at people with health conditions who may have lower levels of mobility, and who at that time were being asked to stay at home and shield because of COVID-19. The booklet contains ideas and inspiration to help people to build activity into their day, and there's also some detailed visuals to talk people through, walk people through evidence-based exercises to maintain strength and mobility at home. So we distributed the booklet. We had about 20,000 copies developed. We distributed those across Sheffield. We then worked with Sport England and Public Health England to create a national version. I think to date over 1 million copies have been distributed, and there's a full evaluation report available as well. Thank you.
Thank you. So as Anna said, there is a full evaluation report for the Active at Home booklet. If anyone was interested and hasn't seen it already, please do get in touch and we can share that with you and answer any further questions you might have about the booklet. Some of the kind of key learning that came out of the development of that booklet. So there was a real sense of purpose in the collaboration to create this resource in a really timely manner as well. I think it was such a quick turnaround from start to finish, getting that booklet out, printed and delivered. It just felt like that was really important in making it so successful. New relationships have also been developed, and existing relationships have been renewed and strengthened through the development of the booklet. Ensuring that hard copies were readily available and circulated via key partners was really important to reaching the target audience that they were designed for. And using social media to promote this opportunity to the local organisations to generate a distribution list was also important. So now phase 3 of the delivery. So every June in Sheffield, we have Move More Month. And this is just a way of celebrating all the good things that are happening around physical activity in the city, inspire people to get more active and move a little bit more. And usually there is different events that go on as well in Sheffield around the month, and a mass participation event which we organise. So this year we really had to think about how can we make this happen still during lockdown, but more importantly, thinking about We Are Undefeatable and how we can reach those people and celebrate some of the activities that are happening for people with long-term health conditions around and physical activity. So we really wanted to engage and inspire people in a fun and creative way to be more active in June and beyond. So we did several things throughout the month. On the left-hand side, you can see they're not very big, I know, but hopefully gives you an idea of a activity calendar for the month. So each day it gave you a different idea of something new that you could try. And all of the things on there were really able for people to do at home or within a local green space or garden if they had that. But we made sure that it was very adaptable because of people shielding. And the link for the calendar was very much related to mental health and wellbeing as well, as we recognise this to be something that was really important during lockdown. So alongside this, we also had a social media campaign where people shared, we shared different images every day, and also videos from local champions and people who could inspire people from different communities to be more active. So I think it should play now a short video from Safia, just to give you a taste for what that looked like.
Hi everybody, this is Move More Month 2020. My name is Safia Saeed. I am the project coordinator for Reach of Youth / Big Brother Berkeley. Physical activity is very important for me because I'm on the go 7 days a week. So it helps me to stress release and focus more, and it gives me a bit of me time. Physical activity is also very important for Sheffield because there's so much negativity and so much division, but with physical activity it brings groups together, teams together, families together, and most of all it brings communities together. Thank you.
So that was just one of the videos that we shared, and we had them throughout the month as well from various different people. And just to say as well, on the calendar, we had 50,000 copies of that printed, hard copies again, and took the learning from the Active at Home booklet and how successful that was. And they were delivered to 10 of our priority areas in the city throughout the month. Well, it was at the beginning of the month, so they could do the activities throughout the month, sorry. So the learning from phase 3, so social media really helped amplify our message during the month, and it reached more of a professional organisational audience, whereas the calendar was very much for the end user. The most popular videos came from local community advocates. So like the video I've just showed you, Safia, that was one of the most popular. So people could really relate to that, and it was someone who maybe they recognised or felt that it was relatable and inspired them to do a little bit more. And also something that was really successful was relating to what was current, so things like Captain Tom Moore, and then also our local Captain Tobias, who was in the news a lot at that time. So now on to phase 4. So throughout the project, something which we'd recognised and also spoke about with Sport England was the gap around the health charities and the Richmond health charity kind of representation in the city, or us just having that awareness and connection with them and knowing who was working in Sheffield and what was happening around physical activity at these charities. So what we wanted to do was bring people together to invite them to an online workshop to understand, is there a need for a network with the charities around physical activity? What are they already doing around physical activity, and is there anything that they would like to do with some support from the local activation money or from us as a network? So on the screen, you can see various logos, and they're the charities that came together for the workshops. We did invite representatives from all 15 of the charities, and these are just the ones that actually were able to attend or responded to our invitation. And what we found from bringing people together is there wasn't so much that there was a need for, sorry, I've gone. There wasn't necessarily a need for people to come together with a health alliance as continuously, but we were able to build some really good relationships as part of the Move More network in the city that now we can access and build on in the future. Not every charity who attended were aware of the We Are Undefeatable campaign, and also not every charity had the same capacity or resource. So some of them had a local officer in Sheffield, others had a regional representative. So just having that awareness was really helpful, just to scope out what was actually happening locally. And charities were really keen to have more stuff happening, so more sessions that were specific to their group or condition to be able to signpost people to, rather than a generic offer for people with long-term conditions. A lot of the charities had already adapted well to moving sessions online because of the pandemic. However, they wanted more content to be able to signpost people to. And also there was a real recognition that digital exclusion is an issue among some service users, and a bit of a gap there in people being able to access things that they were signposting them to. So as I said, the project enabled conversation and discussions with these charities that didn't previously exist. So that's been definitely a long-term benefit and bit of learning from us as an area. So next, I've got a video from Jo Woodward, who's from Age UK Sheffield. She was part of bringing the charities together, and she has actually been commissioned, or Age UK Sheffield been commissioned as part of that work to deliver something for people with long-term conditions who they are working with. So I'll just play the video, and Jo can talk you through their involvement and what it is that they're actually doing now as part of this work.
Hi there, I'm Joanna Woodward and I'm the Community Development Officer for Age UK Sheffield. My apologies, I can't be there at the presentation today, but I think it's important to give an update on our involvement with We Are Undefeatable. So we initially attended a meeting with Tom from Yorkshire Sport to discuss ways in which We Are Undefeatable funding could be maximised, really to benefit the older people that we work with, and generate something that was actually quite sustainable going forward, and not just something that was sort of a flash in the pan that would be over as soon as it had begun. What we found was that the majority of partners at the meeting either didn't have the capacity and didn't feel that they could commit really to setting up something completely new. But we felt that in collaborating with Tom, we could really use the money to ease the transition out of COVID restrictions, because that has been something really that has been a main priority for us at Age UK Sheffield over the last months and as we move forward. We've got a lot of customers who in essence really have not left the house for nearly 2 years now, and have been unable really to do the activities that they either did before, and they've not even been able to go out for a walk. So in essence, they've lost a lot of strength, a lot of core strength. But the most important thing really is that they've lost a lot of confidence to go out, to join in, to interact with people again, which has just been really a huge, huge problem. And as well as we move into the winter season, we're focusing on falls prevention and such like. So this really fitted very well into what we have been looking to achieve over the last months and as we move forward. So Tom and myself collaborated around the idea really of utilising a preloaded device that people could use at home, and they would have preloaded exercise videos onto it that people could use to just very gradually kind of build up their strength again. And for some people that may have meant that that was all that they were able to do, and that they would never be able really to come back face to face for various different reasons. So it would give them something that they could continue to use going forward that would help keep their strength up. But for other people, we very much felt that it might provide a vehicle to then ultimately get people back face to face once their confidence had been built, once their strength had been built up a bit. And we used an auxiliary. We thought that was quite an important thing for people to feel comfortable. So we're in the process of purchasing the tablets. We have those now, and we're just about to start training staff to use them with a bit of a dummy guide that's going to go out with all of our independent living coordinators and our In Touch volunteers, so that they can talk people through how to use them. And we've already had a few people try them out and said how brilliant they are, and that they've really enjoyed kind of experimenting with the different sessions, and they've really, really enjoyed it. So we felt it was quite a creative, exciting way to get people engaging more and improving mental health and well-being. One of the things that, as I've mentioned already, was the sustainability aspect and the long-term importance of this funding. So by providing tablets that we can keep as an organisation to kind of circulate around people, and it's a relatively low cost exercise really, because once the data is on there and once the exercise videos are on there, then we can just move them around to different people, or we can leave them with somebody who might need it, but we do have that provision there to kind of move them around. And we're hoping as well that this will give quite a rich picture around people's journeys, because our ILCs do go out and speak to people months after months, and they track their journey for lots of different reasons. We should obtain quite a lot of nice data around how this has impacted our customers that we can pass back on, obviously, to show the impact that this has made. A couple of things that we hadn't thought about at all, and actually seemed pretty obvious when we came to it, but there was a few things that we'd not considered. So, for example, stands. We hadn't thought about stands, or the fact that obviously people would need something there to be hands-free to be able to use. Also, whether or not the tablets that we were purchasing were suitable for older people. So, were they bright enough? Was the type big enough? How easy were they to handle, to hold? Did we need cases for them to make it a bit easier so that if they dropped them, they wouldn't damage them? Because sometimes devices can obviously slide out of your hands quite easily. So little things like that. We hadn't even really thought about. Unfortunately, we were lucky enough to speak to an organisation who had done this and kind of road tested it and already got some idea of what worked and what didn't. So we very much used that to fuel our programme, which has been fantastic. We are in the process, as I say, of training staff to do this, and then hopefully we'll be able to start using them in the next few weeks. And we'll be able to provide hopefully some really good data off the back of that. So it's just an opportunity to do something a little bit different, a little bit creative, and we're very excited about using this moving forward and promoting it as a really good way to ease the transition for older people back into exercise. So I hope that that's given you a little bit of an update as to our involvement and hopefully how we can use this funding to best effect in the short term, but also in the long term. And thanks very much for listening.
So that gives you hopefully a good insight into the work in phase 4 and what's been commissioned. Jo started to share some early learnings there as well about what they've found already as part of delivering that work, and we will be doing a full evaluation of that. But as you could see from what Jo was saying, it's very early days in them rolling out those tablets and that work. So I'm just going to bring you on now to the last phase of the project. Again, this is one that's very much still active, but I'll talk you through it today and the learning that we've found so far and how we've got to this point. So with the support from Sport England, we're able to go back to our original plans. So at the very start of We Are Undefeatable, and the work around primary care networks and what we wanted to do in that area, and we were able to go back to this once the lockdown measures had started to ease and sort of the pressure on the healthcare sector and the communities. With that said, I know that is still very much there, but after speaking to the clinical lead for the primary care network and partners within the community, they were happy to pick this up and really wanted to give it a go. They saw the value in the opportunity, and so that's what we did. So the action in this phase, after speaking to local people with long-term conditions, they highlighted some specific gaps, and these were the actions that came out of it, or some of the potential solutions to kind of helping those gaps close and people to be able to take the opportunity to be more active. So the first one was to re-engage with the community, and doing this by recruiting a part-time community worker who can specialise in physical activity. So really engaging with that community, but with very much a kind of an angle of getting people more active. And so their role will be to run a series of different workshops and taster sessions to help increase people's confidence and interest in different types of activity, and to get them out and trying something new. The second part of this is around digital inclusion. So that was very much identified as a gap for people to being able to access different things online. So the idea is to have some digital inclusion training for people with long-term health conditions, with support to develop digital guides to their condition. So this is very much co-produced, and they'll provide information for other people on how to live well and manage activity with a long-term condition, and signpost them to further resources, and I highlight opportunities for peer support. So on the next slide, I've just got Dr. Andy Douglas, who was the clinical lead, who is the clinical lead for this stage of the work, who just wants to share a bit of a perspective from a primary care network during this project, and also the pandemic as well.
So I suppose the most useful part, probably from my point of view, is how evolving PCNs work with people who provide physical activity or approaches to activity, and tips for how other PCNs could learn from what we did. So the PCN we work with is called Healy Plus. This is a primary care network, basically a collection of 9 different practices who all work in the same local geographical area with the aim of sharing resources and doing kind of different initiatives for their local populations. So we came at it just as GPs were starting the rollout of the vaccines. So we came at a time when these PCNs were already really busy and really stretched. So it was a tricky time trying to judge whether we were going to get real engagement from GPs, nurses, link workers, healthcare assistants that work in the practices. And we had a couple of pauses because of this, and then ended up starting kind of later in the year once the vaccine rollout had happened. One of the benefits really, and how it would work really well working with other PCNs in different parts of the UK would be that this PCN already had really great links set up between their clinicians and their healthcare professionals and local third sector organisations, voluntary charitable organisations. That was both on a kind of organic level from the clinical staff, but also really enhanced by their link workers. So they had 3 link workers working throughout the primary care network, and they really know exactly what's going on in the ground in this area. They know their population and their people, particularly people living with long-term conditions. So definitely working with those kind of link workers and the links that the PCN already had with these organisations was absolutely key, really. And I think that's even more so true at the moment since the pandemic, when the NHS has been extremely stretched, and we got the sense that there was a huge amount of enthusiasm and engagement for trying to help people get more active. Of course, it would help problems with mental health, inactivity, people getting more unwell basically because of the effects of staying at home for such a long time. They were so stretched that they could join the meetings that we were setting up, they could go to the primary care network meetings, but they really didn't have the resource and the time and the manpower to really engage and implement the projects on a day-to-day level. They were very much there to link up, advise, support. But I think projects like this are going to happen in the future in the NHS, while the NHS is still in such a stretched state, I think it'd be important to recognise that maybe this work would be better led by either someone who was a specific funding or role to do this, but maybe ideally from someone like the link workers or organisations themselves. And I think our whole project was kind of slowly figuring this out, and I think by the end we realised that the Healy Trust, which is one of the kind of overseer organisations of a lot of the local charities and third sector organisations, they were better placed really to take on this project with the kind of the support and the engagement of the primary care network. And I think that worked better really because they seemed like a better organisation to oversee the whole thing and have that, you know, more of a grassroots link with local people, but also, you know, a really good link, especially through the social square link workers with the practices. We found that there were several leaders, GPs, and also leaders in terms of the administration staff within the PCN that were very enthusiastic and happy to engage with this because they knew the value of it. And I think that was a really key part of making this a successful project. Having regular meetings with the clinical staff was useful for continuing that engagement with the staff and making sure they felt included, integrating it with their pathways they'd already got running for their long-term conditions. So an example of that might be that if a nurse or a doctor is seeing someone with diabetes or asthma in the clinic, that they're well aware of what the project is so that they can kind of refer or signpost or link into the project that will finally produce. That exercise in itself is just useful for strengthening the bonds between frontline kind of healthcare staff and these the sector organisations. So I think in kind of summary for this project, I think the PCN is hoping to engage patients with long-term conditions in activity. A key thing would be to have the real buy-in from the whole of the clinical staff, but in particular the leaders within the PCN, and then really strong links and engagement with their local population and patients, but also those kind of third sector community charitable organisations. And I think that was the strength of this project. And then we found to actually kind of let that kind of flourish in a more sustainable way, it needed to be run probably by you know, a local organisation rather than the lead taken from the NHS there due to the strain on the NHS at the moment. And I think the two projects that were ultimately kind of decided by the co-production group and passed over to the Healy Trust to run will allow it to work in a more long-term way, ultimately benefiting patients in the longer term.
Right, so just to touch on some of the wider learning outcomes in summary to that phase. So the dedicated funding to support this work has enabled the city to work in areas and have conversations with organisations that we wouldn't have previously. The additional project may not see immediate impact on the physical activity levels. However, by creating these new connections, it's led to further conversations that have helped to connect the system to itself better, which in turn will lead to future collaboration and hopefully an increase in physical activity levels that we can actually see the impact of as well. And in recognition, as Andy said several times, that the voluntary sector organisations are often better placed to deliver these projects, and the ability to work with them to co-design interventions is really key to strengthening local trust, both with them and also people living within that local area. So I'll really quickly just try and go over the next steps. So as we've said, some of the projects are still active. So it'll be to support Healy Development Trust, which is the voluntary organisation, to recruit the part-time community worker who specialises in physical activity in the role that they're going to be doing, and also around the digital inclusion training. and Age UK, the tablet lending scheme, to offer support and guidance around that. And with both of them, just make sure that we're capturing further learning as well, and evaluating both of those sort of delivery aspects of the overall project. So I think I'm just continuing what I've already said, just, yeah, really about sharing the learning and continue to connect those partners, not just into this campaign and project, but into wider things happening in the city as well now. So finally, as you can see, we've been through quite a lot in this project. It's created a really good opportunity for the city and also partners in it. So what we would recommend to other areas, and for us as well in future projects, is to really build on what's strong and go where the energy is, utilise the expertise which already exists in the system, bring people on the journey with you, so learn, design and deliver together, co-produce your approaches and do this from the very start. Learn and adapt along the way, which we've done a lot of during We Are Undefeatables, be open to new ideas and willing to give them a go. Often this is where the greatest learning is, so just take the risk and take time to develop local relationships with partners, and create those networks across the sector, because that's kind of the basis of being able to deliver a lot of this work in a timely manner as well, and have those trusted relationships from the very beginning. So that's everything. Very much a whistle-stop tour there, but hopefully it gives you a good insight into the work that we've carried out over the last couple of years.
It definitely does. Thank you so much, Rachel.
You.
That was really helpful, really great stuff. That clearly many different elements to the work you've been doing in Sheffield in different phases. I personally found it really interesting that the doctor who was talking about building those strong links between the PCN and the local community organisations. Really useful piece of advice, and also building on what's strong is something that we've heard come out already today in some of the other sessions that we've been hearing. In terms of, there were a couple of queries in the chat about is there a national version of the booklet that's still available, and we've put links into the chat that hopefully people have seen, so you can still access at least the version from online. Not sure about hard copy, but online they're certainly still there, the Sheffield one and the national one. I just wondered if, in summary, you could reflect, and looking across all the very many different things that have been going on in Sheffield, on what one thing you're most proud of or pleased about. I think that would be quite interesting just to hear from you. Yeah,
it's really difficult because there's so much. I could take something from each phase, definitely, but I think the main thing is what's highlighted from what you've said on the chat is probably the Active at Home booklet. I think it was such a quick response to what was going on around us, a really good collaboration between lots of different partners, and initially it was just something that we wanted to do in Sheffield to address the need and the situation that was going on, but now that's that the reach it's had has just been incredible, and I don't think anyone ever expected that to happen. So I think that has to be the thing that we're the most proud of. However, there's lots of other things, but I think that that's probably got to top it at the moment.
And given there's been quite a bit of interest in that, even today, but just in general, could you talk a little bit more maybe about the distribution partners? How did you find the right partners to get involved to help you get that booklet out to people who needed it? Yeah, so as part of Move More, as I said at the beginning, it's a network of partners from across the sector. So every aspect of anyone who, so we've got children and young people's schools, health and social care with GPs who sit on it, environments. So within that, we have people from across Sheffield who come together on a regular basis to connect around physical activity. So we have a really good reach already, building on what's strong. Those trusted relationships already exist into getting to where we need to be. And one of the ways that we did it with the booklet was through pharmacies. So we actually had a link through one of the partners to the local pharmacies, and we were able to get them delivered out, the booklets, to every pharmacy, so they went out with people's medication. And I think that straight away was a massive reach, and something that we were able to do quite quickly, and we knew that would be getting to the people that we were, the people who were shielding at home, and the people that we really wanted to reach. And again, on Andy's point, who was the GP, around the community links,
and those relationships. That's such a massive one, and something that is really hard to get to unless you are from one of those sort of trusted anchor organisations. So having those relationships already there with those people and those organisations to get to the people that we're trying to reach was really, really important as well.
Thank you, really, really interesting. And my last question was just about the Health Alliance, because not all areas have been able to develop their relationships with the local charities in the kind of way that you did. So it's a really interesting one. And it led to that really concrete project that I think is still underway with Age UK, really interesting one. How do you see those relationships with the charities continuing moving forward now?
Well, I think the main thing is, just as a starting point, is that we know who they are and where they are now. We've kind of just as simple as we've got that contact list and kind of a face to the name, people know who we are. One of an example of something really practical is in the new year, we're supporting Diabetes Sheffield with an event around physical activity. So that's something as well now that we're able to do. So I think just by making those connections and starting the conversation around physical activity, it will, even if it's not directly funded through the We Are Undefeatable local activation money, it will provide and hopefully create more and more opportunities in the future where the charities will think maybe about doing something new, or if it was something that they're already doing, involve us and other partners in the city to kind of make that bigger and better and the reach even more. So I think it's hard to know exactly where it'll take us, but I think it's definitely already we've seen the impacts of that, and it's a great start to build on some new relationships.
Yeah. Definitely, it seems like the foundations are really there now to take you in different directions depending on what's relevant. Thank you. I think we'll start to wrap up at that point. Really appreciate that presentation, Rachel. Really enjoyed it. Thanks to everybody who's also joined this session. I hope you'll join some of the other area sessions that are taking place as well over the next couple of days. If you do have any questions or follow-ups on this one, feel free to get in touch with me, and I'm happy to direct those in the right way, Barbara at insightangels.com. But for the other sessions, although formal registration is closed now, you can actually access meeting links to all of them from any of the session invites. So hopefully see you at some of the other ones. But let's close there. Thank you very much, everyone.